Now, the government employees medical scheme says millions of rand is being lost to wasteful behaviour and abuse of the healthcare system. GEMS says the industry is losing around 22 billion rand a year to fraud from high-cost medication or people being billed for services not rendered. For more on this, we're joined by the GEMS' Dr. Stanley Moloabi. Dr. Moloabi, thank you so much for making time. 22 billion rand, that's how much is being lost to fraud, waste and abuse every year. That's a lot of money. What kind of fraudulent cases have you identified as GEMS?
Good afternoon, Clement, and to the viewers. And let's start by saying that the 22 billion figure is an estimate. And then also, it is not only attributable to fraud. We talk about fraud, waste, and abuse. And these are very, at least the fraud is distinct from waste and abuse. The line between, there's a thin line between what is waste and abuse. So certainly 22 billion, it's a lot of money in its estimates for the whole entire industry, which is worth, around 200 billion. And you basically asked me what sort of types of abuse are there. So there are different categories, certainly. There are those where, and let's start with the fraudulent ones. It would be a claim submitted by a healthcare provider, but they haven't rendered the service. There could also be collusion between a healthcare provider and a beneficiary of a scheme, where they basically, as an example, the scheme member asks for money, then the doctor or the healthcare providers, because it's not only doctors, the healthcare provider then claims to recoup those funds and also make a profit. And then we also have things like schemes where a person is admitted into a hospital when they really did not qualify to be admitted to hospital. And then the hospital and the healthcare provider, they claim, and he also gets the benefit of the cashback, insurance claims. So those are examples. Then we do have things like waste, and waste would be where, for instance, you go to a doctor, the doctor sees you, and maybe it was not the doctor that you normally see, but you, for some circumstances, you went to see them for any ailment. And then the second day, you're still not feeling okay, you go to another doctor, they prescribe you medication, and you didn't reveal to them that you had actually seen another doctor. So you end up having multiple prescriptions, and that's why people end up having pharmacies at home where they have medication that they didn't use. That's wastage, right? And then abuse would basically can fall into the category of those, let's say the medical aid pays from my medical scheme, and for my spectacles, and they restrict that you can claim every 2 years. When I qualify to claim again, I go to the optometrist. My eyesight hasn't changed. The prescription is still the same. My spectacles are still okay. I mean, I've taken care of them. Then, but because you are entitled, then you basically said, no, I want other type of spectacles because I can claim for. So that would be the type of abuse. So that are the different categories.
Yeah. How do you identify these cases? Are you getting tip-offs? How does it work?
Yes, we do have a tip-off line, and it often happens when we send a message to our members that we have received a claim from a healthcare provider, and then the member says, but I did not go to that doctor. Then they are aware of our fraud line because we promote it in our newsletters. Then they phone the fraud line to say, I've received this claim, but I've never been to the doctors. That's basically one of the types of tip-offs. Then we also monitor and evaluate the claiming trends. And then outliers, when there are outliers, and then these outliers are very significant, then we go and check, in our claims and check if there could be activities. And from often we find that there is some activities that is suggestive of fraud, and then we would then investigate these.
Yeah. How are these fraudulent claims bleeding the industry, and who are mostly the people that you investigate? Are we talking here about general doctors? Are we talking about highly paid specialists? Are we talking about pharmacists?
Yes. So I'm just going to mention the categories that we have dealt with in terms of what the current trends are showing, that we are having problems. It's the pharmacists. We have also the dietitians. We have picked up quite a lot of these with physiotherapists. Yes, there's even the general practitioners and the orthotists. And this is based on our information within GEMS.
All right. Thank you so much for making time, Dr. Stanley Moloabi, who is with GEMS, talking to us about how this fraud, abuse and waste is actually costing the industry.